Okay, everybody, welcome. Ralph Havens and Jen and Baden. And we'll have Dr. Tom Giammatteo on in a little bit, chiropractor, naturopath, acupuncturist, and also integrated manual therapy. So let me just share this to our group because it's going to be on your link if you're on our email list about this. Okay, there's that. Save. Save it there. And here. Okay, and we are live. So one thing that I'm going to ask Tom. We're going to see what Tom wants to talk about. But one thing I'm going to ask him is, how is it that some people have certain conditions or certain things happen to them? You know, an injury, an accident, a car wreck. They get some sort of infection or a disease, but they may or may not get some treatment and they get well. And then other people have a similar history, but they're left with lifelong disability and pain and problems and sadness. So what's that all about? And so how come sometimes stuff doesn't work as well as you want? And I was thinking of three people in particular. I didn't tell Jen beforehand who I was thinking about. I meant to, but there's three people that I'm thinking about. And over the years ago, they had seen me and they had made steady progress, and they did most of the things that I asked them to do, and were working really hard at it. And stuff changed. They definitely changed, and I saw things get better and better. But there were some parts that didn't change enough for them, and they didn't get all of what they wanted. And so I was thinking about that. And Jen was talking earlier about our band Walk Off the Earth that we like, and how they went from working really hard at what they were doing, but nobody knew them. And then one video went viral, and then everybody knew them, and it was an overnight sensation. And so
like literally overnight, they like woke up the next morning to millions of views on this video.
Walk Off the Earth, the 5 guitar, or the
5 peeps, 1 guitar or something.
Yeah, 5 people, 1 guitar. So why is that? So let's let me make sure I can catch when Tom gets in here. So yeah, so anything you want to say about healing or people? Oh, and also we just got off the phone with a friend of ours, Jen did, and hopefully we'll have her on. So if she's listening, we're going to be doing it all things Heidi and holistic. Hopefully very soon.
In the future, yes.
Maybe sooner than later. So a shout out to that, and very cool information coming in if you're interested in some very off the grid kind of ways of thinking. So yeah, so anything you want to say about like healing and when it doesn't happen and just stuff like that?
Yeah, I don't know why some people heal and others don't always. I mean, sometimes you can figure it out and sometimes you can't. But I know something that's been really useful for me that I've been thinking about the past couple of days is just having that mindset of that all things really are for our good. And that can be a really hard space to go to when we're going through something particularly traumatic or difficult, right? But when I look back at my life, I can see how even the hardest things, and I think you've talked about this, like those end up, if I allow them to be, they can be my greatest teachers, my greatest times when I've transformed. Like the most powerful transformations I've had in my life haven't necessarily always been, sometimes it's from positive stuff, but a lot of times it's from challenge and even what some people would consider traumatic things. And but that can be a really tricky place to go when you're in the middle of it. But I think the more that you transcend things by having that mindset of, these are my opportunities to learn and grow, and remaining in that space as much as possible, it helps me have a different perspective when I'm moving in the middle of something that may not be comfortable, either physically or emotionally or spiritually. But it also it gives me a sense of peace ultimately in life. And it truly empowers me. I'm not just oh, I survived this situation or this hardship. Like, I actually was given gifts by it, and I'm a better and stronger and more informed and more resilient person for that experience. And so I found a lot of value there for myself in life. And I think that's another layer of self-love as well. Like, you know, owning our own strength, and instead of maybe judging ourselves for being in this situation or this or that, like really understanding that if we allow it to, it can be very powerful to see everything as working for our good, and also seeing those opportunities as places where maybe on some level we have asked to transform or grow, and it gives us that opportunity that really we couldn't have done through maybe an easier path. Sometimes you can do it through an easy path, but sometimes you gain more gifts if you happen to be presented with, you know, a harder, more challenging situation. You can use that to leverage how many gifts you get out of it and how much you grow. I don't know.
Cool. Reminds me of I need to go back and post another video, because there was a video I posted a few months ago. A big wart started growing right out of my head. I forgot if it was on this side or this side. A big, ugly wart, and I thought, oh my God. And I actually did think about going to the doctor and having it cut off or something, but I researched it, and it sounds like it would leave a scar and burning it off and all that kind of stuff. So I thought, well, your body's just detoxing, you know, the HPV virus. That's what that is. So so I took a lot of extra ginger tea and a lot of turmeric and a lot more fish oil and garlic, and then over about a month it just fell off. And so so Ben had a bunch of warts on his hands, and so we used the same process, and over the course of about a month or so, maybe a little more, they all started to fall off or go away. They were like, they're gone. And I asked him just the other day, and he said, yeah, they're all gone. So it reminds me of one time when I was, before Matrix Energetics, before all of the stuff we're using now, we were using this medical intuitive model, integrative manual therapy that Tom actually taught us a lot of. And this one guy had come to see me. He was a friend of an IMT therapist, and he worked for a big self-help guru that you would all know. And he had an issue with varicose veins. And so he was seeing us, and we were working on him, and he had some conditions related to that. But the varicose veins were not going away, but we saw a lot of improvements in ranges of motion and how he was walking and how he felt and all sorts of stuff, but it was going too slow for him. So he decided to go do the surgery. And I then was talking to his friends who we know, and they said, yeah, he was really not happy with the result. It didn't get him what he really wanted. So, they said, yeah, and you guys were really helping him. So sometimes we don't know how much we're helping people. And while some of the stuff that people want to go away hasn't shifted enough, other stuff is different. So we'll see. We should have Tom on pretty soon. Let's see, we're about 10 minutes. We're about 5 more minutes before Tom shows up. So I'm on YouTube right now. So if you go to our YouTube, you can type a comment in and let us know what questions you have for Tom. If you're dealing with a condition that's not going away or not going away fast enough, or you've tried a lot of stuff, let us know what's going on. Even if you're watching after this is just a replay, because I always look and try to answer anything I see from people. So so let us know what you think. And Tom will be on in just a little bit. See if anybody's saying anything. I'm going to go share this on Facebook.
I was thinking a little bit too lately about, you know, for me, certain autoimmune things that I feel I'm able to keep at bay by the choices that we make with lifestyle and diet. And that I appreciate, one thing I appreciate about this approach is that, you know, it could be easy to say, oh, I don't want this or that symptom. It's uncomfortable. And there is a point where maybe it would be, you know, inhibiting my functionality in life, and I'm not in a place like that. So, but I I would rather have, if it's not extreme, I would rather have my body giving me information about how it's really doing than, kind of doing things that cover up symptoms. Like why is a virus coming out of our hands? It's awesome. The body can get a virus out by using warts, and then they fall off if we support the body in processing all that. And I don't know. I just think there's some value in having some patience, and unless it's really inhibiting your ability to function, if you can stay with something and keep that communication really clear. Like I like having really clear communication that is not affected by trying to suppress a symptom with a medication. Does that make sense?
That's pretty cool. Yeah, clear communication. It's not always the answer you want, but it's like it's letting you know something's up.
Right.
It's kind of like if you have a little warning light off on in your car, you don't want to just put black electrical tape over it so you don't see it. You want to like go figure out what's going on. And but sometimes it can be hard when there's a solution, a medical solution of just like cut something out or take a drug to stop a symptom. But I was thinking of one of those people that that got a lot of help from us, really did well with a lot of things, but didn't get totally well. And she went back to some of the medications that she was on or was thinking of taking before. And I saw her again and just to talk to her. And yeah, life wasn't going quite as well as we had left her. So I think what I found is that's why we have so many different avenues to go out and try to help people get well. There's the nutrition, and then there's the wisdom healing qigong, the different kinds of ancient exercises and mindfulness exercises and the mindset things, and clearing all sorts of victim patterns and making sure you're not putting a toxin in your body, and maybe you're going off of gluten or making sure you don't get fluoride. And there's all sorts of things. And there's also like, what do you really want in life? Your vision, and is there something you're supposed to be doing in the world? And this challenge is a gift. Like for me, I am really grateful now that I had 37 years of anxiety and sweaty hands. It really limited my life severely, but it made me really look and look and look and look. That was the only thing I wanted to fix, and I did. And then there was new stuff. But if I hadn't had that challenge, there would be no End Anxiety Forever, no more sweaty hands online product that I have now. And people wouldn't be getting clear of that stuff. And and if we hadn't had the problems where we slept outside and we had lost so much stuff, we wouldn't have the Enlighten Up and Get What You Want class. And so it seems like our challenges can be the thing that then becomes something that's a big blessing, and it's a way to help somebody else solve it. And these days, what we're finding is education is so much different than it was before.
It's exciting. It's empowering how accessible education is, and it's just moving so quickly, and we can learn from people who have done the things successfully that we want to do.
That's the truth. Like I was at a big conference in Nashville last week or so, and one of the guys his business was doing other things, but when he was basically helping entrepreneurs build their businesses, but he had decided to lose weight and get in shape, and so he hired a mixed martial art champion. He just knew the guy, and he said, "Can you just train me and get me the right diet and get me my exercises?" And he was starting to get in shape and look good and feel good, and his clients started noticing it. So they asked him, "Hey, can you show us how you did that?" And so he started showing people and getting results with them. And then he made a little online course for people, entrepreneurs, business guys, to get in shape. And the thing is, he wasn't a health coach. He wasn't a personal trainer. He had no credentials. But he did have a way to get himself fit and look good. And these guys that were other people like him, business people, entrepreneurs, they didn't want somebody with a bunch of credentials and would give them a whole bunch of exercise and a whole bunch of things and turn them into some sort of like health guru. They just wanted to learn how this guy got himself fit. So even though you might have a challenge of some type, some sort of health concern, if you've solved it or on the way to solving it, there's people that are looking for you. So so maybe that's why some people aren't getting totally over things. They still have more to learn. So just ideas. We're kind of hanging out. We're waiting for Dr. Tom. He should be on any second. And if he's not, it'll be me and Jen, and we'll call it. And Baden. So let me go look at the YouTube. If you are watching, let us know. And if you're watching later, put a comment in and we'll make sure Tom gets it, and we'll answer it as well. So a little downtime, pause for your station identification.
I might go check and see if he sent a message or anything.
Okay. So so one of the things that I'm up to is I've decided to start doing a few more projects. One of them is with our End Anxiety Forever program. I'm going to, it's already a set program. It's already getting good results. We already love the way it is and helps people. But I've decided to start doing some more live calls during it, just to ramp it up a little more, get some more energy in there. So so look for that pretty soon. And oh, I think I see Tom. Okay, so let's bring Tom on, unmute. And should be happening pretty soon.
Hi, Ralph.
Hey, Tom. And I don't see a video yet. Oh, hey, let's see. Do you see a video thing? I know I have to make you a panelist, I think, again. Let's see. Make the panelist. I just do this every time. We've been talking about stuff. We're up for whatever we're going to talk about.
Okay, start video. Let's see.
Yeah, there you are.
Yep.
Okay.
Hi, everybody.
Good to see you, Tom. Good to see you.
Great to see you too.
You're sideways right now. There you are.
Okay, let me just see if it flips. This,
Oh,
how's that?
Yeah, it's perfect. It's perfect.
Good.
And yeah, those are the books that Tom has written and co-authored behind Integrative Manual Therapy. Awesome books. I'll let him talk just so you want to just describe them for us just before we start.
Well, we have 8 books in total, Ralph, and these are the professional books right now. So the red book was the first one that we used on the autonomic nervous system, and it was co-authored between Sharon and I. And that one talks about getting spasms out of autonomic nervous controlled musculature. And it was the first book that I've ever known, and the only book talking about how to get autonomic spasms out of musculatures. So what's an autonomic muscle control is things like your arteries and veins and your swallowing and your digestion. So we developed a protocol, and this was probably the first 150 techniques, and now we're probably up to 300, and to look at smooth muscle contraction and how it affects people. So in there are, you know personally, and how fantastic they are for opening up blood supplies. And I just performed one about a half hour ago on a gentleman called the aorta technique. And a lot of people are hunched over and have a forward neck, secondary because they have a spasm in the aorta. And just by sitting in the positional picture, and maybe later on, if you remind me, we could send them that page so people could try it on each other.
That's awesome, Tom. That would be.
Yeah. And so, but he was having neck pain and he just recovered from shoulder surgery. So if the aorta, the main pipeline for all your other blood supply, is in chaos and is tight, you can't breathe, you get headaches, it gives brain fog, it can promote a stroke, it can increase your high blood pressure. So that's a really cool one for about that.
That is a real cool one. I've got a good story about that, because my first experience with having a practitioner work on me, I wasn't able to run for 8 months, and she found a problem with my arteries and did the technique for all the diaphragms, which is an amazing gift that you guys gave us to release that tension, and then did the big artery, the aorta, and a couple of big veins that go into the heart, and I was able to run right away. And I kind of like to talk about it like Like if somebody could magically put a finger in your chest and just scratch your aorta, do you think it might make you nervous? And because it's like all those techniques also took a lot of anxiety out of my system.
Yeah, we have anxiety because of a lot of things that we have gotten micro injuries in the past, and they are we have to work and operate all day long. So a lot of our energy goes to suppressing all the pains and aches in our body. And I really describe integrative manual therapy from an old osteopathic point of view. And Andrew Still was the father of osteopathic medicine. And somewhere along the line, somebody quoted him saying that you get 1,000 extra bonus points in your body structure. And when all those go haywire, then you have the presentation of disease and discomfort. So you know how we bang the table, or you stub your toe and you jump around for 2 seconds and you just carry on. But there could have been actually physical damage there that your mind is willing not to feel. So that takes a little energy each day. And being an integrative manual therapist, we find 5 or 6 of those each time we treat somebody. And the energy goes back in and does total healing. We've tried to talk about Lyme disease, and it's hard with an IMT philosophy to say we do help people 100% recover from Lyme's, and a lot of help with those pieces. My question is, why did your immune system go so bad that you allowed the Lyme disease to overtake your body? It's not this super powerful thing, and we have Connecticut is the mega center of Lyme disease, and why are some people presenting with it and some aren't? And I've probably been bit by a tick 100 times just because of the nature and the environment I'm in. But why don't I express it, and why does somebody else do that? And you even talk about yourself, Ralph, as being a marathon runner and being at the top of your game, and then all of a sudden it all crashed down, and you've had to rebuild all those little micro chips in your body and get recovery, and you've returned to your health. And it's been an amazing journey of learning.
Yeah, and that's what I was kind of thinking about today as I was getting ready for our session with you. Was anything else you want to say? And there's all those other books too, but anything else you want to say? Like, why is it some people have an injury, a car wreck, and they just go right on through it? Like maybe a little treatment, or they just take a week off from work or a few days, and then they're back. And other people, they have what seems like the same kind of thing, and years and years later, they're still dealing with it. Or people have the same kind of conditions, and they go see a similar person that has miracles with one person or a certain person, and then the other person shows up and they don't have the changes. What do you attribute that to?
Well, reflecting back on starting my physical therapy journey in 1982 to now, so we're talking a 40-year history of medicine, right? That I find that people come in different flavors, and everybody's flavor doesn't match what they like and they can do. But I do believe in the triangle of mind, body, and spirit, and it has to fit somewhere on that parameter of that connection. And it may not be totally structural. Hi, Jen. It may not be totally physical. It may not be totally spiritual. And sometimes you hit that special piece that everything falls together for that client, and they fit into your model perfectly. And then sometimes it's that there's always 10% that I can't help, and what I tell clients is, let me come and work with me a little bit. And if my system doesn't work, maybe I can recommend somebody that I know of that can help you feel better. And if that doesn't work, if you do get better, call me, because I want to learn from that experience, because I don't have all the answers. And I truly believe that maybe 1% of the process of people having illness is in their head, like the patient is to blame. And then everything else is that I haven't found the answer or haven't discovered yet to how to help that person. So I take the responsibility of not being able to work. And Ralph, you know this, that we've grown immensely, and we've never stopped asking the question, how do we do it better? How do we work it better? And that's sometimes the frustration of the students saying, just give me a simple 1, 2, 3, and I'll figure it out. And it's, that may work for 3% of that population, but you have another 97 that don't work together. So it's finding, it's truly the enjoyment of meeting a person and helping them figure out what their experience is in life and helping them get better through it.
That's so good. Yeah, I remember once in St. Helena, California, a group of like 60 practitioners, and I was in a class that the night before I looked and I was like, oh my God, I don't even have all the prerequisites. So I already had my anxiety, and then I was like, good Lord, what am I doing? And in the class, Sharon, out for some reason, said, pinpointed me out and said, it's Baden. Hey, dude.
Hey, Baden.
Said, when Ralph gets to where we are, we're not going to be here. We're going to be farther down the road. And I was like, oh, why did she say that? And she saw me at lunch. We were all in the same line to get food. And she goes, are you okay? And I'm like, yeah, I'm okay. But I wasn't that okay. But yeah, and I've noticed with your work and with our work, there's been, bye, Baden, with our work, there's been times like I went from a Rolfing kind of background and then a Feldenkrais background and was getting lots of clients from doctors with this kind of approach, and then went into the integrative manual therapy route. And a lot of those doctors quit sending people. It was just a little too weird for them for some reason, even though the results were bigger for a greater proportion of clients. And then went more into the energetic route and just keep looking for the next thing. And you guys have also gone next layer, next layer, next layer, even though some of the practitioners then just get weirded out, or you're like, I can't go that far. Or it's like, but you have a thing. One reason I like hanging out with you is you have a thing like your thing that you seem to like base it on is what else can I learn here, and where else is the answer, and not so much like you just got to stay in the same paradigm. So I appreciate that a lot in the way you approach things.
I always liked the first basis of when I got trained as a physical therapist. And back in the day when I got trained, it was either you're a neurological physical therapist or you're a sports medicine physical therapist. And the neurophysical therapists always had gyms where they worked together, and there was a community. Right. And so I never wanted to be in my office by myself treating people. I always wanted to have somebody, 5, 6 people, a community to help, because more eyes on a problem and appreciating the person's specialty is always an amazing way to go.
It's
right?
amazing. And I mean, and you guys took it to a whole level where there'd be 30 or 40 practitioners in one room, and you guys were overseeing all of that. And in our own clinic in San Diego, we had 5 therapists, everybody in one room. I do miss those days.
Yeah.
It was a fun way to work.
Right. And it's enjoyable that everybody has a little bit of a specialty that they want to focus on, and you can mix and match, and you don't have to be, it's the team approach to make sure. And, you know, the thing that Sharon really emphasizes, the client or the patient should come first.
Yeah.
And, you know, it's patient centric. It's not egocentric type of thing. So I always enjoy the community of bringing things together. And even in my office today, we have Nancy, who's my main partner, and we have 2 or 3 other practitioners that come in, and it's, okay, give me your opinion at the end of the day. What am I missing? You know, because we all get stuck in our ruts.
Yeah.
And yeah, so that's a nice piece of integrated manual therapy. It's, let's try to do it better, faster. And the principles of integrated manual therapy, again, Ralph, we touch on about 150 different systems. One's emotional, one's spiritual, one muscle. And we've all seen miracles out of 1 or 2 techniques that that person stands up, and that's 50% of their cure. And those are the super rewarding ones. So you don't get invested like, I studied this so hard and I need this to work for somebody. And it's like, okay, this tool doesn't work right now. Let's try another one, and let's help you manage that path that you've been on and things like that.
Yeah, and I like the idea that like if you're an acupuncturist, that's great. But if the primary problem isn't caused by something in the meridians or that energy flow system or in that model. Maybe it's in a spiritual thing, or maybe it's in a you gotta fix up an artery thing. So having different models to look at.
Right.
And also one thing I really liked about IMT was I had been studying a lot of upledger stuff, and then there was the visceral manipulation and mechanical link, and then I had all my other Rolfing things and Feldenkrais things and everything else. And so my evaluation systems, I had many different evaluation systems, but I was like, and then what was cool about IMT is there's a systematic way to go and see what system are we dealing with here, like what's primary. Can you talk a little bit about like how you find, like if you have like, there's a spiritual thing and there's something that happened in the past, you know, you had a bad childhood, and there's a few car wrecks, and there's a history of car wrecks and why is somebody in car wrecks, and there's a certain medical condition, and there's different systems that are involved. How do you go about finding like what's the thing that can shift it, the domino that once tilted hits the other dominoes?
I'm going to step back and give you a little bit of history first. That you know, today's titles is Integrative Manual Therapy and the Connecticut School of Integrative Manual Therapy, and our founding schools and teaching systems were once called Dialogues in Contemporary Rehabilitation, and we were just physical therapists at that point. But the mission of Dialogues in Contemporary Rehabilitation, probably since 1985, was to be inclusive, not exclusive, to say that we should be patient-centric, not egocentric, and we will advance all forms of medicine from a medical point and then bring them into mind, body, and spirit. So Western medicine only looks at the technical anatomy and physiology, and they don't want to hear about any mind or any spirituality in the person. So we are very, the first level of the school is very anatomical and, you know, muscle gaining and talking about that. And then as we have the confidence of the practitioner or the person wanting to study that, we then move into the other processes. And, you know, we know that they work, like acupuncture or chakra work or Reiki work or off the body work. And we've gone and studied those just like you have. And what I found frustrating was that they all had their own system and they all had their own limitation, right? You got to that big muscle in their back area and you did their special technique, and they called it maybe, you know, the liver meridian, and they would pump and it throb, and that was the end of it, and they never had an explanation on that. And what we found, that was frustrating. So we would argue, we would sit there and go, well, did that feel like the artery release? Did that feel like the vein release? Did that feel, we tried to put an anatomical structure to it, and that gave us more of a communication skill to start to describe things. And even when you went to study matrix, we found, okay, Ralph can do it by focusing and the shoulder girdle would just relax. That's kind of cool. But how did he relax it? So we came up with terminology, and we tried to broach those pieces and put it into this big puzzle, again, because each person is a matrix of all those different processes, and you have to figure out what's the key to that person. So there's been many healing styles over the years, and people pay for traditional medicine, but they pay for their chakra readings, they pay for their aura readings, and they get healed by those things too. So there's an amazing process that I've appreciated since 1996 when I got to work with Dr. Upledger, that we don't know enough, and we should be appreciative that people heal, and maybe we can learn something new.
Yeah, I remember when I first saw a video of Dr. Upledger. I was in the first couple of years of being a physical therapist, and my boss had taken some Upledger stuff, and I saw a video of him just kind of holding on to somebody's ankles and then saying, oh yeah, something's releasing up in their diaphragm and over here and over here. And I looked at her like, is this for real? She said, yes. I still was so skeptical, but for some reason that was the version I started gravitating towards because the results were just better. There's a cool story, I'm sure, I probably don't even know the whole story, but I remember when Sharon was first telling us about bone bruises, and it took quite a few classes before you were allowed to take the technique to fix up bone bruises. she was telling the story of the TV show Friends and how all of a sudden it was like, it's a thing. But she found a few things before it came out in the medical research, and then it showed up in our hands because Sharon found it.
Right.
Found it first, and then it showed up in the medical research, and it was exciting times to follow you guys around because it was like we were like, oh my goodness, what's next? Anything you want to say about bone bruises? Because that was just the coolest thing.
Well, right now that's taught in day one, and I do it in the community evening sometimes, Bill.
Oh my God, we had to take multiple classes, and it's like in cranial 3 you can get bone bruises. It's like, God, just give me the bone bruise.
Yes. Well, we were really cautious, and you know, even the NFP that I've given you some copies to pass out to your friends, Sharon in her first years of teaching that literally you had to come in and pay for one of her therapists that knew how to do it for an hour, and that therapist would just hold it for the hour, right? And we were getting amazing results with all those pieces. So a bone bruise is a technical term for damage of the bone tissue, okay? And a lot of people have the image of bones just being rock hard, okay? And in children, they need to be flexible, and they need to be
They need to bend.
pliable so they can continue to grow. So they're made of cartilage, and they bend. And there was a study in World War II where they took soldiers that had just gotten passed away, and they were working with their bodies, and they actually stripped the bone of the thigh down and were able to bend it 45 degrees before they even saw a crack in it. Wow. And it would snap back. So it's almost like a green, fresh branch that it should have pliability and flexibility to it. And when you get injuries to it, then it gets more rigid. Okay, and there's been a lot of Chinese medicine, Ayurvedic medicine, and different types of processes figuring that out. So a bone bruise can be everything from a literal fracture where you tear the bone apart to where you just have a ding on the side, like I describe it as you dropped an apple and now it has a soft spot on it. And the body will actually use all its muscles to stop you from tearing it more. So I feel that 80 to 90% of everybody that has a tight hamstring that ever lived has some bone bruises. And when we have fixed that technique, their flexibility gets deeper and deeper because the hamstring muscle is protecting the femur, which is the bone, from wanting to tear or break.
I know a lot of times when we work with you, you know, you work on us or tell us what to do to ourselves. It's a lot of just here's a bone bruise here, here's a bone bruise here. And the results are big just from getting those pieces cleared up.
I think that was a lot of the work you gave us when I was pregnant with Baden.
Yeah.
Yeah. Well, again, when we go into our female fertility model, we're having to have this nice new being come into a woman, and she has to have all these expansions. And it's like, okay, let's make sure why is the muscle going? Why do some women have back pain and other people have neck pain and things? So if we can figure out how to help that woman stretch out because she's designed to do that, and we can fix those things, then the pregnancy is much easier. You know, everybody that we had in our fertility program, we had 17 births over 8 years, you know, when we had the big clinic of our therapist. And every therapist that focused and had IMT in their weekly regime was touching the floor with their hands from day one to the day they were pregnant. And so that means all the joints around the hip were able to open up, and the birthing process was down to 2 hours sometimes, right? Yeah. So we develop a bone bruise just like you would ding an apple. It doesn't go away until we actually do this technique. And I've never found another technique and a severe tear of the bone material that wouldn't need to take hands to apply to it, right? To push those bones together.
Teach how to change that. There's just the MRIs that say, oh, they're there. And one thing I got to interject at one point, when I got into matrix energetics, I just had to see how far that would go. and I went for a couple of years where pretty much that's all I did. And Ben was born during that time. I was also having some health challenges that I wasn't finding. What was going on was the fluoride thing that was affecting my bones. But I thought, oh, everything is all energy. Everything's all energy and mindset, and you can just shift it with a little, tweaking of the system. And while that was really useful for so many people, and I'm so glad I went that route, I came back around to using all of my training, the integrated manual therapy and nutrition, and you got to make sure you're not putting a toxin in your body too. And so I don't know where I'm going with this exactly, but I know where I want to go at some point today, hopefully, is one of the things that was so awesome and is so awesome about working with you and back in the day with Sharon, and you guys had multiple clinics all over the world, and then you helped us with our clinic in San Diego and other people like that. We all felt like we were going to be taken care of. Like there's going to be, you can find that if there's something going on that's not right, call Sharon and Tom and just like figure it out and then shift it. And then I've done in-services here in Bellingham, little talks for Bellingham Physical Therapy. And the owner has numerous times said, how do we learn this now? Like, how do I go take classes? And so where do you see, you and Sharon did so much and brought so much to the world, and then things have shifted. And for some reason, this is like, why does she have to be gone now? It's like, it seems crazy. But what do you see as the next step to train therapists? Because this should be a model, I think, where people can just go somewhere and people that are trained like this can evaluate and start to find out what they're protecting and what can shift it. And then it should be, it's a whole model of healing and health. And where do you see it going? And what are your thoughts on what's up for practice?
Today is the 5th anniversary of Shannon's transition.
Wow, I didn't know it was the day. Man, Tom. Thank you for being here.
Yeah, well, I'm so grateful that I feel that I still have communications with her. So she made me the person I am, and I'm now the conduit to support all those transitions. My perplexity is that I feel that the internet is very powerful, and I'm gotten stronger that I would like to bring out the new IMT and gather the old IMT practitioners and bring them together and start that. Yes, we're being taken care of together, and I feel that we still have that support here. If you got a question, I'm here to support anybody in those answers. I don't know how to teach touch over the experience of touch is my big perplexion. I mean, the words are out there, but Ralph, that's the component of how do I know what your butter feels like is my example. Do I know if your butter's been out for 3 days or it's been in the freezer for a day? And how do I know what you're picturing until I see your hands working, and then we can have an experience and say, this is soft butter and this is hard butter, and and you may see it as blue butter and yellow butter. That's okay, just as long as we could call it hard butter and soft butter at the same time. When we get the language, then the communication can go. And like, that you had the basic language so you can understand and appreciate when I say, okay, Ralph, remember this technique and this is how it felt. So just make it a shade different. And that growth, that's my perplexity of being able to experience touch without biased and out prejudiced, and to be able to say, this is soft butter and this is hard butter.
And there is a difference. Like, I do a lot of work over the internet with people, yet it was so useful when Jen was pregnant and to put hands on. There's a difference.
So I had an angel that funded, and the website should be up by June, that we will have all the books on the internet. So students will have a library of the books that they can go and access at any point and use that as a working template. And my goal is the next 10 years, that's my passion, is to make this as big and bigger. And I want integrated manual therapy to be the next form of medicine that incorporates chiropractic, naturopathic, and the healing arts, in those pieces. And so that's my dream. And that was Sharon and my dream together, was to promote that piece.
Yeah,
And to have a foundation, we can have even a hospital that's based off of integrated manual therapy with all the good parts of medicine in it, and a collaboration of testing, and then to have a place that we can do farming and animal support, and almost have a community of all those. That is my ultimate goal for IMT, is to have that the next form of medicine. And watching the journey of osteopathic medicine, watching the journey of chiropractic medicine, I feel we're there, and we've had our bumps, and those are 200-year-old medicines now, and they're just becoming emerging fields on their own. We just gotta figure out the way that, politics and big business have corrupted a few of those things along the way. But they never win out in the long run, right? Yeah. Acupuncture is still here. And I hope someday somebody's quoting you and me having this talk, and grabbing the red book and doing the aorta technique or doing the bone bruise technique, just like somebody says, well, grab your kidney 6 for bladder infections and stuff.
Yeah, Bellingham Physical Therapy has the red book, so they
good.
Have quite an experience. An hour session over lunch.
So on a personal note, get me out on the road, and we start teaching that way, and we reorganize. This is the decade to do that. We're empowered to move that forward again. So
okay.
I wonder too if things kind of come full circle, like bookstores, right? Like
they do.
Something about being in a bookstore. And I heard recently that Amazon is actually starting to set up bookstores.
Of course, yeah.
So, and I'm finding in my personal life that how much I appreciate in-person conversations, or conversations like this, where actually having a conversation versus social media. And so I think we might be coming back around to valuing, some of that in-person time where you are learning how to feel with your hands and have that common language. We might be cycling back to valuing that and figuring out, new ways.
Yeah. But in the future, there may be the videos and concepts, and then having a half-a-day module where you go and meet somebody. But
that's true. Yeah.
The reward of the school, and you're a graduate of the school, Ralph, to see that transformation when you're talking about such unique body systems that never have been touched before. Everybody expects to get old and feel pain, and you have the rare 90-year-old that's still hiking mountains. I feel that person is optimal, and everybody should be sad that they're not getting there the same, instead of saying, oh, they're just weird, right? That should be our optimal lifestyle and our presentation. So I feel that IMT is always looking for the optimization of that. And I just took in a client in her 40s. Her husband is a radiologist. Her best friend is the surgeon. And she got a referral from a person studying alternative medicine and say, I think you should go see Dr. Tom. And her orthopedic surgeon said, this is a woman that liked to walk her dog 5 miles a day, be outside, try to do the best for her. And she said she was overweight in her 20s and 30s, and that caused her knee arthritis. And then within 3 visits, all her knee pain's gone away. And she came the other day and goes, well, I think it's working. I'm not sure. I'm feeling better. My husband's looking at me and saying, well, I don't know, but you're dancing a little bit better than you were before. And they just don't have the spectrum sometimes to see that.
Isn't it funny? It's so true. People cannot even realize everything that's shifted when they get to be more of just who they really are. It's amazing.
Yeah, and it's almost like Christopher Columbus saying, no, the earth is round, man.
Yeah.
and everybody has this flat concept. And I mean, you guys are products of that too. Look how much your diets have changed and how much you appreciate. And if I say Doritos, you almost fall over. And that's true.
I used to eat every Monday was nachos from El Zarapi, and I start the day off. I start the evening off with M&Ms and Coca-Cola. So
yeah, I was there too, man. I had Doritos and Pepsi and a scoop of ice cream, and that was awesome.
I know, it was good. Well, good deal. Well, this is exciting. Yeah, I can see it's so amazing. Isn't it just amazing and how miraculous and synchronous things are on Sharon's, the anniversary of her passing? It's like, I knew it was this month, but it just,
Yeah, today's the day, and I woke up and heard from her and read another beautiful poem. Maybe I'll share with you next time. But yeah, I feel that she is more powerful on the other side and working through me. And I get students calling up, oh, I had a dream about her. And I always ask for those sharing moments and stuff like that. So
I bring her in my matrix sessions. You guys are always there, you and her. So, it doesn't make you worry. We're not making you too tired, not to worry.
no.
Well, this is awesome. Yeah, this will be really cool to see how the year goes. It's going to be a big year of a lot of change. There's so much stuff changing right now. I can see so many things that are crumbling in the old system.
Yeah, I'm excited to be here with you. And I feel that, this form of communication, and as we work together, and, we've talked about other structural educational pieces that you're going to teach me how to get on. I've been developing and writing, and the work is there. Now we just have to figure a format of platform that we can help distribute and be able to help mentor.
That sounds good.
Because again, if I talk about butter and you think it's solid and I think it's soft, the techniques won't work as well.
Yeah. You got to have some hands-on with this for sure. Just one thing I liked about this system is there's no ambiguity to it. Like it's either a bone bruise or it's not. It's not, or it's either you've changed it or you didn't.
Right. And that's, I feel, one of the tools that we learned early is this mapping. And you have this problem area and you choose your therapy, matrix or acupuncture or everything else. I feel that gift that we discovered helps the clinician decide that I do it or not.
Yeah.
I change that. I know I've promoted health in that person.
Yep.
And then you can stack all your other studies upon it, which is the most amazing thing that I like about what we do is there's an honesty of that and that feedback.
Yeah, I had a time before Matrix. Danielle and I were doing a demo at the office, and we had a lady, and she had all sorts of tightness in her neck and shoulders and some other problems, and she bent forward just 20 degrees or so when we tried to forward bend her. And when I did the mapping, it all went to her superior vena cava. So I thought, oh, this is cool. So I did the compression syndrome to release the tension around that, and then Danielle and I, for about 10 minutes, just cleaned up what are called disruptions of membrane and cleaned it up. And she had all this range of motion, and she bent forward. And it's when Jen was there. That was the first demo Jen saw. And I knew it was going to be a good result because after I did the technique, I remapped and all the mapping looked good. So I thought, oh, this is going to be good. And then we confirmed it, so everybody could see range of motion. So the mapping is, I think, the key, because with mapping, you can find the physical things, the mental, the emotional, the spiritual things. You can find out what ages things happen, and also the priority of what's important to treat first.
Right.
And then go and retest again. So it's an awesome.
And it's one of the foundations. And after we get that, I feel more communication can be done on videos and internet pieces, but it's still a palpation skill of how do you describe it as soap bubbles or grains of sand.
Yeah, I remember when my first class with you guys, you were teaching us the little motion, the inherent motion that goes with infection. And I was like, can you just show me one? Because I couldn't feel it. And then and you said, oh, here's one. And I put my hand on the body, and it was like, oh, that's what it feels like. So I wouldn't have been able to do that just over the airwaves.
And when the learner discovers that, when they discover that it may be not in the right words, but in the experience, and when they can follow the experience, like how do you truly describe a sunrise, right? Or again, if they see it in colors, if they see it in sound, if they have to describe it someplace else, as long as we call it a bone bruise or a disruption of membrane, and we can find it, that we can then figure out how to have that conversation around that resolution of that tissue system.
Yeah.
And that's the fantastic thing about it is after the student let goes, well, you told me it was sandpapery, and it really feels like jelly bellies in there for me. Okay, but
But
that,
it's the same thing, yeah.
yeah, I can't tell you your interpretation, and that's something about language, right? If you were, if you know that Blanco in Italian means white, and I show you a card and you say Blanco, and I need to hear white, that doesn't help you get better.
Yeah,
Well, Ralph, I have to go in a minute, so
very awesome, Tom. Good to see you. Willie, we'll keep on cruising, and
okay,
really good day, man.
have a good day.
Okay, bye, man.
Bye.